Hello guys, welcome to my channel, and today our focus will be diabetes. We will look at the main two types, causes of each, pathogenesis, symptoms, complications and treatment modalities. Kindly consider subscription. Let's get started by looking at the general definition. Diabetes mellitus, DM, is a chronic metabolic disorder characterized by persistent hyperglycemia, high blood glucose levels. It results from deficient insulin secretion, defective insulin action, or both. Insulin is a hormone produced by beta cells of the pancreas and is essential for glucose uptake and utilization. Long-standing diabetes leads to damage of blood vessels, nerves, kidneys, eyes, and heart. We have main two types of diabetes. Let's focus on type 1 and type 2. Type 1 diabetes mellitus, T1DM, insulin-dependent. Type 2 diabetes mellitus, T2DM, non-insulin-dependent. Initially, type 1 diabetes mellitus. 3. Causes of type 1 diabetes. Autoimmune destruction of pancreatic beta cells. Genetic predisposition, associated with HLA-DR3 and HLA-DR4 genes. Environmental triggers. Viral infections, e.g., Coxsackie B virus, toxins or stress. Leads to absolute insulin deficiency. 4. Pathogenesis of diabetes, general, applied to type 1, autoimmune reaction destroys beta cells. Progressive loss of insulin secretion. Absence of insulin causes low glucose uptake by tissues. Increased gluconeogenesis and glycogenolysis results in severe hyperglycemia. Fat breakdown increases, thus ketone body formation. Can lead to diabetic ketoacidosis, DKA. Symptoms of type 1 diabetes. Usually acute onset, common in children and young adults. Classic triad: polyuria, frequent urination; polydipsia, excessive thirst; polyphagia, excessive hunger, weight loss. Fatigue and weakness. Blurred vision, if untreated; nausea, vomiting; abdominal pain; fruity breath; ketones, risk of coma. Complications of type 1 diabetes. Acute complications: diabetic ketoacidosis, DKA, hypoglycemia, due to insulin therapy; chronic complications: microvascular, diabetic retinopathy, diabetic nephropathy, diabetic neuropathy, macrovascular, coronary artery disease, stroke, peripheral vascular disease. Treatment of type 1 diabetes. Insulin therapy is mandatory. Multiple daily injections or insulin pump. Blood glucose monitoring. Dietary management. Balanced diet with controlled carbohydrates. Regular physical activity. Patient education and prevention of hypoglycemia. Type 2 diabetes mellitus. Causes of type 2 diabetes. Insulin resistance in peripheral tissues. Relative insulin deficiency. Strong genetic predisposition. Obesity, especially central obesity. Sedentary lifestyle. Increasing age. Pathogenesis of diabetes, general, applied to type 2, target tissues, muscle, fat, liver, become resistant to insulin. Pancreas initially increases insulin secretion. Over time, beta cell exhaustion occurs. Insulin secretion decreases. Hyperglycemia develops gradually. Ketosis is usually absent or mild. Symptoms of type 2 diabetes. Insidious onset, often asymptomatic initially. Polyuria and polydipsia, mild; fatigue. Recurrent infections, skin, urinary tract; delayed wound healing. Blurred vision, may be diagnosed incidentally during routine testing. Complications of type 2 diabetes. Acute complications: hyperosmolar hyperglycemic state, HHS, hypoglycemia, due to drugs. Chronic complications, same as type 1, retinopathy. Nephropathy, neuropathy, higher risk of hypertension, dyslipidemia, cardiovascular diseases. Treatment of type 2 diabetes. Lifestyle modification, weight reduction, regular exercise, healthy diet, oral antidiabetic drugs, metformin, first line, sulfonylureas, DPP-4 inhibitors, etc. Insulin therapy, required when oral drugs fail or during stress. Regular monitoring and complication screening. Thank you for watching. Kindly subscribe, comment, share, and like for more related uploads.